Hello, everyone. I'm Sherry Hughes, and welcome to CCA's Medical Minute, sponsored by Kroger Health. It is our 57th episode, and oh my goodness, we're still in the month of November, which is Movember, and we say that because it's to raise awareness of men's health issues like prostate cancer and testicular cancer, as well as some other things. Joining me today, my co-host is Andy Guinigundo, our Director of Precision Oncology. How you doing, Andy?
I'm great. I'm great.
And we have a very special guest that I'm so happy to have with us here today, Jim Anderson. Jim is a former Cincinnati Bengals coach with, about maybe 29 years of coaching experience for running backs from 1984 to 2012. And Jim is also a 15-year prostate cancer survivor. That deserves an applause there.
Well, thank you.
So good to have you, Jim.
Well, it's great to be here.
And we're going to unpack a good bit of things coming up. But first, we're going to go to Andy really quickly. We want to mention that Steve is out today. He's actually at MD Anderson, getting more PSMA testing done for his prostate cancer. So as our precision oncologist, director of medicine, refresh us, what does PSMA mean, Andy?
So a PSMA is a prostate-specific membrane antigen test. So that's a lot of words. That's why we abbreviate it, right? But really, what it's a special scan that can identify where prostate cancer is. Now, it's not 100% foolproof, but in my realm of precision oncology, it's important because anything that you can see on that scan, number one, tells us where the cancer is, but actually opens the door to a newer medication on the market called LU-177. So this is an interesting drug in that it is a radiopharmaceutical, so it's radioactive, but it attaches to this PSMA. But it also has, it's like a Trojan horse because it has a chemotherapy payload in it. So it delivers that chemotherapy directly to those PSMA, did I say that right?
Yeah.
PSMA cells and kills them off.
Yeah. That's very important.
It's very promising.
Very promising. And so Steve is there at MD Anderson getting this. So now we're going to unpack a lot. And it's hard to not talk football when Jim Anderson is in the house because you know what? You've been there in the NFL, seeing strong, tough guys playing football and coaching them. Yes. What, first and foremost, Jim, is your message to men who, as we said earlier, can sometimes just be stubborn about their health, but you understand because you got that diagnosis many years ago with prostate cancer?
There's no question about it, Sherry. One of the things that in football, you always have your wellness exams. And the wellness exam was the basic foundation of finding out, actually, that I had prostate cancer. And we have the yearly check. And my PSA was 2.0. And it went up to 2.5. And Dr. Doug Logan, he said to me, well, Jim, you've been steady at this 2.0 for a long time. Let's just go have a check. Let's just go in and get 2.5. It's up a little bit. Let's just see. And he said, but I'm sure you're all right, but let's check it anyhow. And I did, and eventually through biopsies and that type of thing, I found out that I did have prostate cancer. And then from there, obviously, when you find out you have it, it knocks you down.
It's a shock.
When somebody tells you have cancer, boom. But then you have to get yourself up, just like in football.
Yeah.
You got to get off the grass and get up, and then now take action. And like this pin says right here, it was a critical catch.
Critical.
And one to intercept cancer. And what you do, it's like a pick six. When you intercept cancer, you can take it all the way for a touchdown. And right now, I'm 15 years into it.
I love that. So you got this in a touchdown,
great.
right?
Yeah.
Andy, Jim just said something really, really crucial in terms of numbers, and where you're looking at different numbers in prostate cancer to detect it. Is that a part of what Steve is doing with the PSMA looking for the lower number? Or?
You're correct. I mean, so the PSA is a blood test,
Right.
and we use it as a tool for screening. Normally that number should be under 4. So it's interesting. Your doc was like, Johnny on the spot.
Right.
He's like, it's been 2. Why is it now 2.5?
Yeah.
Exactly.
So like I said, he's Johnny on the spot. But yeah, those two concepts have to do with each other. The reason why you can do this blood test and find, geez, this guy has a good probability of having prostate cancer is the same way that this this special prostate cancer scan works.
And Jim, what do you want men to know? Because we know that 1 in 8 men will be diagnosed with prostate cancer in their lifetime, but 1 in 6 African American men will be diagnosed. So that means that the risk is even higher for men of color, Black men in particular.
There's no question about it, but the thing you have to do is you have to have a dialogue, have to have a conversation. Don't keep it to yourself. And then you find out that not only you may have it, but other men in your family may have it.
Yeah.
You see? And I think that was a critical part of it. And I found out through conversation. And then share. Once you find out you have it, and you take steps to eliminate it in your body, then now you have to share that experience.
Yeah.
And then you share the things that made the journey a better journey for you, because it leaves the fear for others.
Yeah.
And so, I think that without a doubt, conversation, wellness checks, and then just be willing to say, hey, you know what? Go take a screening. Now, the biggest problem I've had, honest, with prostate cancer is talking my son into going to get a check.
And why do you think that is? Why do you think that men are so reluctant, is the word I was looking for a little bit earlier?
Well, number one, they're stubborn. And number two, a lot of men think there's only one check. And that's the check where the doctor has to go internally and see if he has a nodule. But there's not. You can have that PSA. And then the other thing is, you have to hear it from someone else sometimes.
That's why I'm glad you're here.
Because what happens is, if I'm talking to my son, he says, "Oh, Dad, you know."
In that tone, right?
Yeah, you know what I mean. But what happens is, when someone else says it, it's like, okay, he got his checked, I can get mine checked.
That's right.
And then maybe we can, through conversation, we find out that maybe someone else in our family had it.
Yeah. Speaking of that, Jim, genetics, that's your world,
Yeah,
Andy.
for sure.
What can men expect? Do you advocate to get genetic testing, or is there any kind for the prostate?
Sure, yeah. The genes we talk about for breast cancer, for example, BRCA1, BRCA2, BRCA1, BRCA2, they raise your risk of prostate cancer as well. So, we look at people's families and they say, well, my mom doesn't have any breast cancer on her side of the family. There's some on my dad's side. It's like, well, and by the way, Dad also has prostate cancer. Well, maybe Dad has prostate cancer and his mom has breast cancer and his aunt has ovarian cancer because there's a BRCA gene.
Yeah.
There are other genes involved. And so, really the recommendations nowadays, anyone certainly with advanced prostate cancer is eligible for testing, but it's certainly something to consider and to talk with your provider about. Should I get genetic testing because of my family history or whatnot? But yeah, no. Even if a man with advanced cancer doesn't have any family history, we're still testing those guys. Again, looking at the precision medicine piece of this, there are drugs associated with a positive BRCA test or a positive ATM test, which is another gene. And so we don't want to leave any of those doors and any of those stones unturned.
We sure don't. Well, Jim, you look fantastic.
Well, thank you. Thank you.
You look like the picture of health. How is life for you right now?
Life is good. I because I'm traveling, I can do things.
You miss football?
You know what? You miss football, but you miss the relationships more. And that's the key. I mean, with the medical, the people ask me, "Are you going to move?" I say, "No, I'm not going to move." They say, "Well, why not?" I said, "I value the medical help, assistance that I have here in the city.
Right.
And I can always come back, but I remember back, 15 years ago, when this stuff knocked me down. That it was a doctor who just said, 'Hey, let's just check this out. Let's not let it go.' and it wasn't really high.
Yeah.
But it was something that it was a little change in my body.
So I say advocating, getting educated, being aware, and making sure that you go get those annual checkups.
Yes.
You know, for men and for women.
Well, you know the thing I found out through research and talking to people, and I don't know if it's true, Andy, but it's through our mothers that we contract prostate cancer.
Because he was talking about that with the BRCA.
Right. No. So it really can come from either side.
Well, I know,
sure.
but it was like I'll say this: all the men in my family that have prostate cancer were all related through our mothers.
Interesting.
You know, all of their moms were sisters.
Okay.
And all of us cousins, brothers.
That's a good correlation.
You know, we are all related, but it skipped a generation.
Yeah, you know, with genetics, for example, you know, when there's a gene, the gene always passes, right? If it's going to pass from generation, it does pass from generation to generation. You can't skip one. Now, you can get one where someone lucks out. They didn't get the cancer.
Right,
they had the gene. They didn't get the cancer, or you know, God forbid, you know, they had the gene, but they were in a car accident or something. They didn't make it to get their cancer. So those things happen too. It's like, oh, no one had cancer, but maybe they just didn't get the cancer.
Okay. Before we go, because we're kind of running down on time, we're going to do a little something. I have a new segment that I have, and it's to help raise awareness and education for cancer, and in particular this time prostate. So this is the word that we're trying to see if either one of you pick up on it. And it's a quick rapid fire. I'm going to ask you, I'm going to give you a word, and you tell me the first thing that comes into your mind, okay? You guys ready?
Yeah.
All right, Jim. Prostate.
Cancer.
Andy, genetics.
Testing.
Jim, therapy.
Eating right foods.
Andy, medicine.
Taking medicine.
One word.
Oh, one word.
Medicine.
Therapy.
Jim, heal.
Wellness.
Andy, solve.
Problem.
All right, thank you guys. None of you got the word. The word was actually cure. The word was cure, but I want to thank you for playing Crush Cancer. That's the name of this. And I'm going to give you parting gifts. You get a pen here.
Thank you.
And Andy, I will give you a chip clip. And
Oh,
this is all courtesy.
Because I like chips? Is that?
Courtesy of Cincinnati Cancer Advisor. Again, that was Crush Cancer. And Jim, we want to thank you for taking the time out of your busy day. I'm sure there's lots that you do. You're helping kids now, right?
Yes, you know, I'm volunteering, mentoring and tutoring in schools, and just trying to show kids a little bit more of what life's all about and the opportunities they could have down the road if they just discipline themselves and do what they need to do in the classroom.
Thank you so much.
Once a coach, always a coach, right?
That's right. He's always coaching in the classroom now. Thank you, Jim, and thank you,
More than
Andy. Thanks to all of you for joining us for this week's Medical Minute. Join us next week, but in the meantime, share it and subscribe if you haven't already done so to our Medical Minute podcast. Have a good week. We'll see you next Wednesday.